visually. It's the way we live our lives walking around. So in pharma, in especially the health authority reporting, why is this hard to take hold? Is it historical? Why are we tied to text outputs? Why do we do what we do, despite recognizing the common sense of this approach? That question is important to me because that gets at the root of what we need to change, let's say. We all want to use better software. We all want to use faster, better processing devices, laptops, whatever. That's not the hard thing to change. What's the hard thing to change?
Perhaps maybe we start with Michael?
Yeah, that's a really difficult question. I think one of the problems is that we are used to work in pretty separated groups. Usually we have data analysts, we have medics, we have biologists. The medic, and I'm a medic, so I know what I'm talking about. The medic usually needs some visualization, some graph, right, to just better understand the data. Whereas the data analyst, the statistician is used to his tools and to using tabular summaries, models, not necessarily visualizations to the same extent than a medically trained or a biologist person would do. And I think that's something that's really keeping us away from setting up visualizations on a systematic basis. And again, I'm coming back to that point I made before. I think it's really important that we sit together cross-functionally and really break down some of the silos that we still have and talk about the added value visualizations can bring to drug development. It's the same story with modeling and simulation that was taken up by the pharmaceutical industry much later than most of the other industries. It takes our industry specifically long to adapt certain methods. And I think part of the problem is really still some silo issues that we have.
Perhaps, Mark, how can we break those silos that Michael's just mentioned?
Well, I think really a lot has to do not just with the visualization. I think visualization is just the end stage of the analysis or what you're looking at.
I think your microphone needs to come on. Ready? Okay.
Okay. So I think it has a lot to do with the fact that visualization is just the end stage of what you're looking at. I believe that it's still biological data. As you can probably guess, I was trained as a biologist or a genetic engineer, so I strongly believe that you can never standardize any type of visualization. So what you really need is solutions that allow you to understand the data, to manage the standardization behind it, and then really work with the data across those different silos. I think that will never go away. So the idea as if we could be solving the visualization problem with a simple click of the button is probably too far-fetched. So you need a solution that takes you step by step, that communicates the analysis that's behind every clinical trial and that will be behind every piece of biological data.
Do you have any thoughts, Professor Asprey?
My disclaimer is I've never actually worked in industry, although as regulator I see the other side. So I was reflecting on what we do in universities. Yeah, because in some ways we innovate, but in other ways we're, like the dinosaur. Our math department still use chalk. And very good technique, and you can draw more easily than you can with PowerPoint. But if I think what my junior statisticians will do, some of them will produce reams of tables, but actually some of them almost instinctively produce lots of nice visualizations, especially as longitudinal data, and they'll shrink them down. I mean, one of the worries is page size. But so I don't think we've ever actually thought about it, to our shame. And in the clinical trials unit, clearly we have some of the same issues. But I think often there's so much rush on getting the data done at all that you then do things in a more conventional way, because it takes quite a lot of investment to get to something. But I think when we switched over to word processors, it took a lot of training. It took buying these massive, expensive machines. I remember you had to book your slot. And you were allowed your half an hour, and then it was something else. And then suddenly the world changes, and everyone's doing it, and the next generation grew up with it. But there was a lot of investment in that paradigm shift. So I guess that's probably the step that's needed.
Vita, where do you think we are with that generational shift? Are we still too far in the dark ages?
I think we're working on it. At least our companies, other companies as well. I think that's proven by the meeting that we have here. And we see that Roche, someone from Roche said they have Spotfire. Obviously, we are working on Spotfire. SaaS is working on improved visualizations. Or I think many students who study nowadays use R, for example, and then because it's for free. So I think that some may probably move in SaaS. And I see in two things basically. One is more an exploratory thing where you collect data or after you have your report, and the other thing is really for reporting. I think that the big move in the reporting area has probably not happened, and that's probably has to do with difficulties to predefine good graphs before you actually see the data, and also I think people are careful about and are not sure about the acceptance it will have with the health authorities, so they'd rather do something they know is going to be accepted, which is basically a table. So for exploratory purposes and for these standard reports, I think that's quite two distinct things, and I think it's good to handle them into word strings, basically.
Moritz, given that we're on this cusp, and you're from outside of pharma, and you're working with different industries that seem to have jumped in, all you hear is visualization, visualization. Are there any dangers with, do you think, from what you heard today about pharma, which is regulated, jumping in and making everything interactive, or?
No, not at all. I think that the beautiful thing about visualization, or for me, the nice thing is also that everybody can somehow relate to it, and it plays such a big role for so many different people, and it starts with the basic researchers, like how they make sense of the measurements they make, to the internal reporting and later the communications, right? And so it touches in the end on everything a pharma company does. You know, if you think it through, and if you pull through with it. But I think the adoption question is a really interesting one, and I think it has many facets, but it's good to discuss it. But I mean, just a few things to put it into perspective, exploratory data analysis based on computers is maybe 45 years old, basically. Most innovation in interactive visualization is from the last 15 years. So we had interesting stuff from 90s and 80s, but most of the stuff really happened after 2000. And until a technology achieves a certain social status and has a social meaning, it takes 10, 20, 30 years, and that's fine. You know, for instance, like email. I think we're now getting to a point where sort of getting email, and most people still, have trouble with it. No, but think about it, and that's 20 years. It had 20 years already of really good adoption. And so I think there's a mismatch in, every half year there's a new tool coming out, or a new, there's another fair and another innovation. But these until it sifts through, it takes a long time everywhere, and I think that's fine. We should take that time.
Yeah, I take the point with email because my inbox always stands around about 400 unread mails.
So, we even haven't managed that really, really simple thing like sending electronic letters, just to put that into perspective. The second thing is, I think, and that's really a universal theme, I think we don't have enough training in visual literacy and in producing graphics. So you can go through a whole PhD, basically, or a whole professional training, and you can have a profession where visual communication would be really helpful, but you have never received any professional training in how to make an effective graphic. I think that's even the default case. I think that's a big gap in how we teach all the sciences, all the natural sciences, is that we sort of teach them independent of graphics, or effective communication, if you put it more in that way. I think that's just a blind spot our educational system has. But I think that could be fixed fairly easily with just, targeted trainings. There's a lot you can achieve if you just have 1 week of training, you're already like 10 times better, I think, compared to somebody who has 0 training. And then hopefully, these things get more value and are more valued in social processes within the company, and then it starts from itself.
I'd like to just bring back Dante, just to, would you like to comment on any of the feedback there, or?
I suppose at least what I heard, might have missed something, but what I heard is that there are constraints, that affect decisions that we in pharma make. I suspect, I can't come up with good examples, that we're putting some constraints on ourselves as well. Mm-hmm. And I wonder what those are. Those to me would be the easiest to fix, such as, you know, we have somebody did say this, that we don't want to try something that hasn't been received well before. That's getting close. You know, I think pharma does push boundaries. We push boundaries with how we design trials. We push boundaries, but when it comes to communicating results, we fall back to the comfortable tables and listings. Maybe it's because of an electronic document template that is written in stone somewhere. That would be a constraint that we put on ourselves. That's what I'm really curious about, is what are these things that we can fix easily?
Mm-hmm. I think there was sorry, did you jump in?
The constraints that pharma puts on itself is we don't know the function of a data visualization. If you look at the presenters here today, there was Andreas Klaas, who presented very simple, concise visualizations that answered a question. So he was looking for simplicity so that the information is easily transferred. Our examples of Hyde's law were very complex, and you do need some knowledge and background training before you can understand those, but as soon as you understand them, they answer the question very quickly. Maurice, his example with the flowers, it was so that everybody could look at this graph and understand it implicitly. So he was looking for general understanding of that knowledge. So you can see there's a very wide range for the type of function of a visualization.
I would like to add that I think pharma can learn something from visualization experiments and projects from other industries. I think we've been mainly dealing with clinical trials, which is, let's face it, it's a scientific experiment under a bulb, and everything's very controlled. What you're seeing is that pharma companies will have to deal with lots of information outside there, like patient outcomes and devices and all of those things. And actually, organizations like the FDA are already doing that. They're monitoring patient communities today to see what they're saying about drugs. I think that those will also become, first of all, input for new clinical trials, but also for the health technology assessments and to look at price and reimbursement and all of those things. So I don't think that it's just about text and reading all the scientific papers. I think we're going to an age where you cannot humanly read everything that's out there, so you need techniques to digest that, to the text analytics, to work with that data. And visualization, again, will be crucial and essential to present that again in a human digestible way. So I think we need, as an industry, to prepare ourselves for that era.
Can I just add also that I don't think this issue is peculiar to pharmaceutical industries at all. I think it's much more general. Having experienced some of the reports that are put in from public services generally, there's a reluctance to pick up some of these innovative ideas. People like playing safe, and they don't get sacked for playing safe. Once you go out on a limb, you might cause a stir. So you have to take a risk, and people are sometimes reluctant to do that.
Yeah. And I was also reminded of something we discussed in the break, and also that ties to the silo point, I think. So often, let's say in a traditional setting, you either have very technical, complicated, ugly information visualizations for the researchers to make sense of the raw data, and then you have highly tuned, polished, but ultimately shallow marketing graphics. Right? And I think where we need to move is more towards a culture where we have all kinds of levels of communications inside a company, and how the company communicates to the outside, or maybe how a company digests outside information, all the time. That's important too. You cannot just live in your bubble and work on all these levels in parallel. But traditionally, these departments are different. They have different budgets. The researchers have no design budgets.
the marketing has no idea what research is doing, and so maybe in the end it boils down to have maybe a few more interdisciplinary efforts to just do a few very targeted projects that show the potential of what can happen when you bring these worlds together, and then hopefully
so communication
have a
is
snowballing
key
thing.
to drive this forward then.
Pardon?
Communication is key between all the stakeholders to drive this
also
forward.
inside while you're working as well. So even if you're like researching, you still have to think about, you know, how do you talk to your fellow researchers and how do you communicate results there? So it doesn't, I think it's an artificial boundary.
I think I saw a hand up from here before,
Yeah,
so we've got another time for another question.
It seems clear that the technology is driving the possibility that we can have more visualizations around. Now that I have the power of a Cray 1 in my pocket here, which, you know, not so long ago would have cost me several £million. And there's an application I can get on here which I can rotate a molecule in real time, which also, you know, not very long ago would have cost me thousands and thousands. But I think also there's software technology, and I think the point you raised about the templates is interesting, because I think we are still constrained actually by the kind of decisions we have to make when we do a graph at a low level, mean that our templates are limited as to, say, the number of treatments we can put in this kind of thing. And I wondered if anyone else would like to comment on that. And I also suspect that the next wave is going to be the interactive document, the kind of document you can build with embedded graphics in, like you can go and read in iBooks, for example. So it'd be interesting to see what the panel thinks about that. Is that the next technology wave, I suppose?
Okay, who wants to jump in with that one? Perhaps Michael.
Well, maybe coming back to the template question. Of course, templates are limiting, but they're also an extremely useful tool to ensure that people adhere to at least a limited set of best practices. So I think you need to have templates, and people not regularly using a certain tool, not regularly using visualizations, they have some very proper guidance by using templates. If you want to go beyond that, you need to have a customizable tool and a really trained and experienced user helping clinicians to interpret data. But I think templates overall are quite beneficial.
Especially if you have a tool where you can create templates. I think that you create a program for a certain type of graph and then you can repeat it on different analyses. But I think the creation of the template, that's really essential. I know some tools where you have templates where it's not very flexible, you can't really produce the graph that you want. I don't think that's very helpful. At least what I need is, I usually know exactly what I need, so I want to create my graph, and then I want to use it repeatedly in different studies, for example, or at different time intervals, or it could be different things, but I want to have full flexibility, and it can take a while to create a graph, but then I want to repeat it usually for exploratory purposes. And I think in terms of future, at least that's what I personally hope, is that databases will be public and that people can actually explore the data themselves to a certain extent. I mean, you need some expertise to analyze the data, of course, but I think like with risk benefit, we've seen an example so where you can shift bars and give different weights to things. The way you feel and how you would rate it, does that make sense to what others think? I think that is something that I expect to come up more.
I think picking up the interactive layered graphics have got to be the way to go, because one of the problems with visualization is trading off between simplicity or having all of the detail. If you're giving a presentation, you've got to make careful choices. If it's a complex graph, you need to give time to go through it. Whereas if you have a simple one that you can interrogate down, say, where did the data come from, or this is where I want to shift my assumptions, that has got to be the way to go. And different people see things differently. I mean, I teach regression. Some you explain it to in terms of lines, some in terms of algebra, some you can talk about, they say, what happens when you put another variable in? You can talk about 3-dimensional and throwing something across a room. Others just glaze over at that. But again, something interactive gives people the choice of saying, do I want something fairly twee with smiley and frowny faces, or do I want it in some other way? So, and in that interrogation, you learn. So, and there's also convention. Yeah, visualizations. I go out, I know which toilets to use because I know that the thing with the triangle shape is meant to represent a woman. I mean, yes, today I'm following that, but yeah, mostly I don't. But yeah, so there's a certain level of acceptance that you need as well. And so there's time to roll that out. But I think the interactive things, yeah, to my mind, it's the only sensible way to go. And that's what's been game changing over the last 10 years or so in terms of technology.
So interactive is here to stay then, I think.
It's a lost opportunity if it's not.
I just think templates sort of relate to the whole issue of standards generally, and I think they're so important in terms, relation to the first question, in terms of the growing adoption of these methods. We do use graphics quite a lot, I think. For example, the box whisker diagrams are used extensively in pharmaceuticals and in healthcare, but they are only used because they're generally understood, and that's become a standard. If it wasn't, then they wouldn't be used because people would be scared to use them because they'd say that people wouldn't understand them. So that's going to need to happen with a lot of different graphical forms, and standards can be absolutely essential in that process to cross cultures, to cross the silos that we were talking about earlier.
But that's a tough challenge for me, for instance, like I think more not from a chart type point of view, but from a visual encoding point of view, like what's the most important dimensions in the data. So I will use them for the spatial layout or the length of the element, things like that. And then in the end, I might reinvent a chart type, which is fine, or I might come up with a new one, but I don't care actually. And but when I tell that to scientists who want to publish maybe in a paper, they will say, no, you make you make this sort of, the neuroscientists, for instance, they always make a 2D thing with a rainbow color palette, and I can give them papers proving that the rainbow color palette is has its issues, and there might be better alternatives, and they sort of see the point, but the improvement is not big enough in order to take the risk of being the outsider in a imagined community of rainbow color palette users. I don't know. So in order to improve, you need to be 5 times better. It's not better to be 1.3 times better. You need to be 5 times better. Otherwise, people don't don't adopt it that way. But yeah, challenge accepted.
Joel, you want to make a point? And I think it will be the last point because we've only got 40 seconds left.
I think with the template, it gives people a starting point. Because if you take a look around the room, this is the approximate number of people that could be on a single study. Like that was being said, everybody has a different view of what the data could look like. So if you start off with an AE template, everybody is starting off looking at the exact same thing and then can move from that template as they wish to investigate different points of the data that they want to see. It's very similar to exploring the data, testing the data with those flower charts, doing it many different ways, and then coming up to one way that maybe is the best for everybody, or keeping everything different.
Well, on that note, we've finished perfectly on time. I'd like to thank all of the presenters that were part of the panel discussion, and I'd like to thank the people who posed the questions as well. Thank you very much. Got a 10-minute presentation from Chris Price, and then after that we'll have a wrap-up with the presentation for the people the presenters and the people who've supported today. And then we'll be on our way.